It is 6:31, and this is the meeting of the Topsfield Board of Health, September 17th, 2025. We now have a quorum of 3 members, so we'll start the meeting. Pursuant to Chapter 2 of the Acts of 2023 and H 2062, as amended by S 2506, this meeting will be conducted via remote means. Members of the public who wish to access the meeting may do so in the following manner. See the connection information on the agenda or on the town website to join the meeting by Zoom video conference or calling in by phone. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the Topsfield Town website at https://www.topsfield-ma.gov. You may also reach out to the Topsfield Board of Health at health@topsfield-ma.gov or 978-887-1520 for information or assistance. No in-person attendance of members of the public will be permitted, and public participation in any public hearing conducted during this meeting shall be by remote means only. The first announcement is that the Topsfield Cable is here recording the meeting. Is there anybody else who would like to record the meeting? Would somebody else volunteer to record the meeting? Because I like to have a backup. Sue is not able to be here to take the minutes, and I'm looking at Carl's looking like he might record the meeting just to have a backup. He probably has the technical expertise.
Yeah, I can turn recording on.
Thank you so much, Carl.
It's a request you need to approve.
We do. Who needs to approve what?
You should have a pop-up on your
Oh,
host
approve.
screen.
Got it.
Mhm.
Excellent. So Carl did it, approved it. Carl is recording the meeting. Thank you, Carl. So are there any other announcements from anyone? Okay, so we always start with a moment of silence. Thank you. Um, s- the first appointment is Carl Ackerman, who is a prospective board member, and he put in his uh, his application several months ago. It went to a website that probably did not monitor it thoroughly, wasn't monitored thoroughly. So it got lost in the shuffle for a couple of months, but it was sent out to you all. And so I have it in front of me, and I'll just try to summarize what Carl wrote. Carl, thank you for being with us tonight. We really appreciate it.
It's my pleasure.
Um, and Carl lives at on Haverhill Road in Topsfield, and has lived there for many years. I don't exactly know how many. He works as a product manager for a company that which he'll tell us more about. He's also the treasurer for Rest Stop Ranch, which is a 501c3 in Topsfield, providing support for long-term caregivers and handicap accessible gardens open to the public. He has a Bachelor of Science in computer science from Rivier College in Nashua, New Hampshire. Oh, it says, I'm sorry, Carl, you've been a resident for 15 years and
Thereabouts.
thereabouts, and has not to date served on any other Topsfield committees or commissions. Um, he said, um, why are you interested in this position? Carl wrote, having helped run Rest Stop Ranch for over 10 years, I recognize the needs and challenges faced by at-risk populations from elderly to individuals with autism and complex medical needs. While I have no training in healthcare or background in the Massachusetts Topsfield codes and systems, I bring a proven ability to understand complex situations and to apply both the rules and intent of systems with a desire to provide a social good. Um, he has attended our meetings in the past. And his vision for Topsfield is that he would love to see Topsfield develop into a stronger community than it already is. And for our town to prosper, he would like to see an honest sharing of ideas that recognizes diverse opinions and allows for individuals to both maintain independence and know that they are in a town that cares for all people. Um, he does not have any business dealings with the town. Um, and that is the essence of his application. I first learned of Carl through John Coulon, who has been. Uh-oh, one person is trying to get in. What does this mean?
It's
Oh,
probably John on his cell
it's
phone.
it's John. All right, all right. It says it. Oh, here it is. You know what? This is what happens when I'm multitasking. Okay.
Oh, it's Richard.
But it isn't Richard because
Oh,
that's his John on somebody else's computer. He can change his name, which he should. John, welcome. He probably can't hear me yet. Um, well, let's see. I can change his name. No, I can't. Anyway, John, we can see your name. I know this is you on somebody else's computer. Can you make the camera work? I don't know. I think John is here. John, can you speak and say something? No. Okay. I first learned about Carl from John Coulon, who volunteers at Rest Stop Ranch. Now I'm getting another message.
oh, I'm trying to reach John.
Oh, okay. Oh, that's you. Okay. Uh, f and so, um, I think John and Carl had chatted about the Board of Health and what goes on, and Carl became interested in it, and here he is. So Carl, we are so happy to have you here. Could you please just introduce yourself? And I'm sure you'll do a better job than I just did.
You did a fantastic job. I'm Carl Ackerman. As the application said, I've been here since about 2009. We bought 2010. We moved in. A lot of what we've been doing here, my wife and I, is growing Rest Stop Ranch into a support services for originally Alzheimer's dementia caregivers, but we quickly learned that there's a broader population that could benefit from IS therapy in nature environments with the botanical gardens we run here. For the last 35 years or so, I've been in IT security. I'm a product manager building, uh, I guess, products that stop Russians and Chinese from hacking businesses and enterprises. I'm interested in the Board of Health primarily because, as a member of Topsfield, I recognize that I have some time to give, and this is something that I think aligns with our mission here to provide support for at-risk populations. And from what John explained, is the board had an open seat, and I didn't need to have any healthcare background or as a nurse or nurse assistant. I really just needed to be able to understand complex problems and apply a rules system to it, with the intent to really provide the best outcome for the largest population. And that's sort of why I applied. Looks like John's managed to get his camera working.
That's because I managed to admit him. So it's a John, welcome.
Thank you. Thank you. Can you hear me okay?
Yes, we hear you.
Good.
I hear you perfectly. Carl just introduced himself. I read his application.
Mm.
Can you add to this because I know you've spent a lot of time talking with Carl.
I have. Um, as I said to Cheryl earlier today, when I approached Carl with this idea, he asked a couple of upfront, intelligent questions. First was, why me? And I told him why I thought he would be an excellent candidate, and he said, "But I don't know anything about health." And I said, "Yeah, well, even people in the health field don't know a lot about being on a board and making sure that a community's needs are addressed and making use of the public health laws and the mandates, as well as attempting to assess needs and meet those needs to the best of the community's abilities." And these are all the kinds of skills that Carl has, and that he's been utilizing throughout gee, what is it? 16 years that I've known him thus far, since he and his wife came to Topsfield, and I've uh, I've seen how Carl can uh, um, uh, assess needs of Rest Stop Ranch and assess the abilities, financial abilities, and human resources abilities, and take on a task and see it through. Well, that's what boards of health are faced with all the time, and sometimes boards of health are unable to fulfill a need, whether it's demonstrated or perceived. But you at least try, and you try to communicate with the community, and these are all things that Carl is able to do. Um, Sometimes not being fully immersed in a discipline plays to your advantage, in that you're able to see it from a different perspective, and you're able to see it in a way that forces you to take a look at the resources available, as Carl will do, and this will afford him the ability to get to know the town of Topsfield demographically, as well as the town government. And Carl will apply the skills that he uses daily in his job. And I understand that Carl's discipline, I mean, his profession, is similar to a board member who recently left the board. Is that correct?
Yes, I think so. Mark Rizza worked with computer security. I'm not sure exactly for a company. Uh, so it's very similar, and it's amazing what a great deal of knowledge he brought to the board. So
Well, um, if anybody wants to take a look at the kinds of things that Carl has done just on their property, we invite you folks to come to Rest Stop Ranch and take a walk around. I think it was about 10 years ago, we had 1/10 of a mile of paved walkways open to people with ambulatory challenges, be it by cane or walker or wheelchair. Now we have half mile, and always more coming. So that will give you a good idea of the kinds of energy that Carl brings to any project. How's
and
that sound?
that was very. Thank you, John.
You're
And
welcome.
I just like to add that, but when I finally get my act together and got the application and contacted Carl, he invited me to come see Rest Stop Ranch, and we sat for an hour and a half and talked about um, everything that the board of health is involved in, but also how Rest Stop Ranch came to be and how he took a vision uh, and applied it to a patch of wooded land with nothing there and made it into a very, very interesting and handicap accessible place. So if somebody who can do that can pretty much do anything, I'm sure.
Yeah. Yeah,
But
my day job with cybersecurity, I grew a security product from about a $50 million business to a $500 million business. I'm now running a product line that's about $20 million annually. Um, all of it's invention work, running projects, Gantt charts, um, deciding that what the requirements are, making the trade-offs to hit a date to drive a business need.
And Carl, you manage teams, international with international members, correct?
Yeah, I have teams all over the US and in India. My prior job, I had a team of about 300 people, developers working on stuff. Now it's a much smaller team as I take an incubation product and try and turn it into a core pillar for security.
Still for the same company.
Two different companies. I worked for a company called RSA. If you ever saw the little authentication tokens, Secure ID, that was a generates a one-time passcode. Now I do cybersecurity on networks.
Hmm. Okay. We should let anybody else chime in with any questions.
yeah, I was going to say, so our members Bill Hunt and Amy Lishko, and if you want to ask Carl anything, if you could just tell a tiny bit about yourself, even if you don't have any questions, and what you bring to the board, so you could see what the team would look like should you join the board.
You
So
want me to
Amy or
start?
Bill? Bill.
Yeah, I'm Bill Hunt. I'm a retired attorney. I've been on and off the board for a number of years, and I've known John and Cheryl for decades, I think.
2006.
Yeah.
You were once the chairman for quite a few years.
Hmm. Right.
Yeah, yeah. And Amy?
Hey, Carl. I'm Amy Lishko. I'm a professor at Tufts University in public health and health policy. Seems like you have some great assets to bring to the team. We're none of us, I think, are very computer literate, so that's like a huge plus to have somebody like that that has some of those skills. So, and also just like your experience just seems very invigorating and exciting. And so love to have your new energy as part of the board.
It's
Welcome.
fantastic. And how long have you been on the board?
Oh, recent. I'd say maybe 2021. Is that about right?
Okay.
Yeah,
Years?
something.
Something
It
like
was
that.
during the pandemic, I think.
Oh
Yeah,
gosh, what a time to join.
I
I
know.
know. It was an exciting time to join.
Yeah.
You
Yeah,
might see,
4 years, something like that.
yeah, you might see Amy walking a lot because
I
you
do walk everywhere, so people
because
know me for that.
tell us about your big trek that you've been on.
Yeah, I do a lot of international cross-country treks.
Oh, that's exciting. I
Yeah,
spent
Caminos, etc. Yeah.
wow. In my misspent youth, I backpacked through Africa for several months from Cape Town up to
Cool.
Cairo.
Cool. Yeah, I love it.
That's awesome. And then Bill also travels internationally because you teach law overseas, which that's about. What can you tell us about that, Bill, at all?
Well, I'm now mostly retired, but I was very active in an organization called the National Institute for Trial Advocacy, which takes lawyers and makes them into trial lawyers, and takes trial lawyers and makes them into better trial lawyers. And this is in addition to practicing law. And even though we complain about our jury system, a lot of the world is coming to the idea that juries are a good thing, and particularly in Eastern Europe. And so we at NIDA would go to these countries and have seminars with attorneys and teach the lawyers over there how to try cases.
Wow. That sounds really exciting and rewarding.
Yeah.
The world is, I guess America doesn't know how lucky they are with the honesty of our system.
Yeah. That's right.
So there you have it.
But then again, you know, then I mean, I always like to tell this story, just this one story,
Yeah.
where I was in Moldova and we were having coffee, and I had to deal with through an interpreter a lot because I don't speak Romanian or Russian, and that's what they speak there. And there was this guy right out of Central Casting, kind of short, you know, a grown out crew cut, um, a black leather jacket, smoked, and as lawyers are wont to do, they tell stories, and the story always starts with, or frequently starts with, so there was this time. And so one of the guys through the interpreter starts a story, and the story starts like this. So there was this time I was cross-examining a KGB colonel.
Aha.
And I thought, man,
This guy might be retired SSB.
right, you know, so that really shocked me awake.
Yes.
So it sounds like we would have a fantastic team, and I think the next step here, John Coulon, do you have anything to add? You flicked on your picture for a minute.
I have nothing to add.
Okay, so the next step is for us to vote, if we can, tonight to recommend Carl to the select board, who will actually also ask Carl to attend one of their meetings so that they can interview him, and then they would be the appointing body. And the next step, oh, while I'm thinking about it, Bill and Amy, you have to go to the town clerk and check in with the town clerk uh, to, because of your appointment on the board. I have to say that right when it came into my head, so I didn't forget. So and because once you get appointed by the select board, then you're required to take an ethics online ethics exam, which is fun. And well, not an exam, but a training, which has sort of a little exam embedded in it. And I don't know if Bill and Amy have gotten that, taken it, but it's all online
Okay,
now.
do I have to do it again?
You have to do it at least every 2 years, if not every year.
Oh yeah, I haven't done it in 2 years, so yeah.
Oh yeah, you got to do it again, and then no longer. So now when you do it and you jump through all the hoops and you take the test, the results go instantaneously and electronically to the town clerk. You don't have to print the certificate out or anything, but I did, and I went to her today and I just gave it to her because I'm old school. But anyway, she'll be looking for that.
Yeah.
All right. So there, um,
So do I do, what's the order of things? Go to her first and then do the test, or do the test and then go to her?
it probably doesn't matter.
I see.
Well, you
Okay.
might need the link.
You'll need the link to it, is my guess.
Did you get the link? And
I do it through school, but I'll check with the town clerk. Yeah. I mean, I also have to do that for school.
Yeah,
And
but this is
Probably similar.
a different test though, because
Yeah.
it's municipal. But
Yeah.
um, I thought the link would have. You know what? Maybe you should go see the town clerk, and she can give you the link.
Okay.
Yeah, that's a good plan. All right. So we can have more discussion, more questions, or someone can perhaps make a motion
To do what?
to recommend Carl Ackerman be appointed to the Board of Health by the Topsfield Board of Select Board.
I move that we recommend Carl Ackerman to the Board of Selectmen as the next member of the Board of Health.
Thank you. A second.
I'll second that.
Thank you. Is there any further discussion? Okay. All those in favor of the motion? Oops, John has a comment.
No, I have a motion
You have a motion?
to accept Carl Ackerman.
you're not on the board
Recommended.
though, John.
Bill made the motion. You maybe didn't hear him. But Bill made the motion and Amy seconded it. So now There was no further discussion. We're going to vote. So Bill just raised his hand. And so, Bill, how do you vote?
Aye.
And Amy?
Aye.
And I vote aye. So it is unanimous. We voted to recommend that the selectmen appoint Carl Ackerman to the Topsfield Board of Health.
Thank you.
Welcome,
Well-
Carl.
Welcome.
Exciting times. As I told John, I said it's pushing my envelope. I'm uncomfortable, and that's probably a good thing. I'll learn something.
Well, I think you'll find it interesting.
Mm.
I personally am hooked on public health. I've been in it for 42 years and been on the board for 22 years. So obviously I can't get out of it anyway soon, but I will try and make it interesting for you. But it's inherently interesting, I think.
I'm sure.
All of
I'm
it.
excited.
Okay. Well, you're obviously welcome to stay on for the rest of the meeting. We have a
I'm recording the meeting for you. I'll stay on to the end.
you have to stay on. Right. I suppose you could record it and walk
No,
away.
I want to stay on.
All right. Will you hear some of the report? Will you hear John and Julia's report? Then you'll find out the nitty gritty too. Oh, but we've been on one meeting before, so you kind of know.
Yeah, and
Our-
I think you still need to accept the meeting notes from the last one, maybe.
Oh yeah. We've got we've got the
Okay.
agenda here. Yeah. Yeah. Sue puts the agenda. I try to follow it unless I have a good reason. Yeah, not to. So thank you for Carl for being here, introducing yourselves. Thank you everybody else for helping us through that step. So these minutes will tomorrow. This will be sent to the selectmen via Kevin, and then they'll be in contact. Kevin or somebody will be in contact with you about going to their meeting. So that'll be the next step.
Fantastic.
Okay. So the next item is North Coastal Management Proposal, post-closure landfill monitoring. We had asked Mike Rustkowski, who is the engineer from North Coastal Environmental, to be at the meeting, and he was unable to be here. However, he did say we could text him or email him with any questions, and I have those numbers somewhere, which I can get if we have any questions. But the proposal was sent to you, and I believe it's actually 64 pages long. And I was just going to try and it's always dangerous to be clicking on things on your computer, but I will do it. Nope. Oh, I know where it is. Now I have to see. Oh boy. So, okay. So I was gonna read it off of here. Oh boy. Oh, I know where it is. Okay. Okay. And I'm just reading from the front page of the proposal, where unfortunately he spelled my name wrong. So I would like to just make that correction. My name is spelled with an S, not a C. Other than that, he said, North Coastal is pleased to submit the proposal to perform post-closure monitoring activities. And now I have to move this so I can see the bottom of it. Oh, yeah. Oh, yeah. Yep. Oh, all right. At the former landfill, which is located at Haverhill Road, the work is required as part of the town's duty to perform environmental monitoring of the landfill to detect and prevent any adverse impacts of the site on public health, safety, or the environment. So there's two parts to it. One is semi-annual groundwater, surface water, and private residential water supply and monitoring, and then there's quarterly landfill gas monitoring. And this contract begins the fall of 2025, so basically now, and continues through June or July of 2026. And then there's a big report that will come to us. And all of this comes under Massachusetts Solid Waste Regulations 310 CMR 19. It new this year is this proposal also includes work to collect and analyze PFAS samples as part of the town's post-closure monitoring plan. And later in the report, it explains a lot about what those are and why they're required. Um, the requirement to include PFAS sampling as part of the town's post-closure monitoring plan is described in Mass DEP order entitled Updated Requirements for Landfill Environmental Monitoring, dated August 5th, 2024. And so the, uh, it goes on in great detail to describe exactly how the monitoring is done and goes into all the regulations. He even has included this year the history of past monitoring decisions that were made so in case people said, well, why are we doing this now? It didn't used to be this way. He's put everything in here that you could possibly imagine. However, anybody, so now we need to discuss this. And if you have any questions, either I or John Boulay will try to answer them to the best of our abilities. And then if we have something that is really pressing that we can't answer, we'll text Mike Rostkowski. So anybody have any questions or comments on this report? Crickets. No. Are we reading it? Do you need some time to read it?
I read it already.
You read it, and Amy read it. Okay. I just want to comment on the part of the report talks about the funds for it. The price has gone up this year. The issue is that the money for doing this testing is oddly not in our budget. It is in the DPW budget, and it's been in the DPW budget ever since I came on the board 22 years ago, and John Coulon could probably vouch for that. And so I had spoke with John Boulay, and I both spoke with Kevin earlier today, and pointed this out. Um,
Cheryl, I don't think we want to take charge of that money. I
no,
mean, it was a DPW project, so when it was operating, so it's their responsibility, right?
well, it's confusing that the contract comes to us to um, approve the activities that are going on, and yet the budget is not in our budget. It's just a little confusing to me. I think it would be clearer if we had it in our budget. On the other hand, it's not up to me to put it in the budget, or I'm not asking for it to be
At
in
the
the
risk
budget.
of being somewhat cynical, it's the best of all possible worlds. We can review the contract and find some requirement that we need to have put in there and have somebody else worry about the cost.
Yeah, I hear your point. And I'm just pointing it out that we're just gonna, in my opinion, what we need to do is approve the work that is described in the contract, but not the money.
Yeah,
This is what I told Kevin today.
yeah, yeah.
And it may change in the future, or it may not. Also, as Bill, you pointed out in past years, there's not even a place for the board to sign this. I remember saying, well, we're going to sign it. And Bill said, but if you scroll way down, there's no
Our
place.
signature's not on it, yeah.
It's for the selectman and then the town administrator to
But the
sign.
selectmen are looking for us for guidance. Do we want to sign this or not? And I think that's all our role is.
Right. Do we approve the
Yeah.
the scope of work and the details as written in the contract.
Yeah.
So, John Boulay, do you have anything you would like to add?
I mean, I think because it's in post closure status, if you look at the Mass DEP requirements, Board of Healths are the ones that are usually required to make sure that there are testing regimens and methane testing and things like that for under the cap. So that is pretty standard for the Board of Health to have to follow up on that on an annual basis.
Yeah, I would agree. It comes under us legally to make sure that it happens, the testing happens. John Coulon has something to say.
Do the annual reports still come to the Board of Health
Oh,
for
yes.
acceptance and review regarding the readings at the monitoring points?
Well, they come to us, and whether or not we review them is an interesting point. Um, we certainly should review them. I think we have reviewed them in the past. One time there was an issue, and this is where the confusion comes in. The report, I know what happened when after Wendy left. Well, when Wendy was leaving, she asked Gary Wilds if he would receive the reports and if there was anything worrisome in them or questionable to contact the board. In my opinion, it should have come directly to the board. But anyway, something was worrisome, and he did contact me, and I went ahead and scheduled it to put the item on the board, on the agenda for a board meeting, I felt the board should be aware of it. And then everyone got upset because apparently there had been private discussions going on among the staff that I had no idea were happening. And therein started a big thing. And but the outcome of it was good because some people didn't know who the Board of Health was or why we were interfering with the work. And so we got that all straightened out a few years ago. And I think we're all clear now because this is the first year, I think, in, well, 15 years that this letter contract has been addressed to me as to the chair of Board of Health. It has always come to the agent or the health director, or in some cases, the DPW director. I mean, if you came here from Mars and you looked at the budget and you'd say, I don't understand why these things are in two different places, but they are at the moment. So if you guys have read it, so if anybody's ready to make a motion, please do so. If not, we can talk about it more.
Well, what the motion would be to recommend that the selectmen sign it, right?
Yep. That
Yeah, well, that's my motion.
okay. Is there a second to? You want to? That you don't want to add any words to that at all?
No.
No.
Mm-mm.
Right. Is there a second to that motion? Let's restate the motion. You just say the motion is for the board to recommend the selectmen sign the contract as submitted by North Coastal Environmental, with the exception of my name being misspelled, and please correct it.
Well, yeah, I mean,
That's not the contract.
you're only on there as the addressee, right?
Huh?
So you're only on there as the, if I recall, I don't have it in front of me.
Right. No, I'm not on the contract. I just forget I
Yeah.
said that. But so the
Yeah.
contract as submitted by North Coastal Environmental.
Yeah.
Okay.
I second that.
Okay. Is there any further discussion? Hearing none, all those in favor of the motion, please say aye. Bill
Aye.
and Amy
Aye.
and myself, aye. Carl, the reason I'm calling out the vote this way is because when you have a Zoom meeting, we have to do a roll call vote for every single vote. So, so that it's very clear, and you have to state your name, which I think they did. Well,
Okay.
I stated it for them. All right. All right, very good. Put that aside. The next thing, oh yeah, so the next thing on the agenda is the meeting minutes of August 20th. And I have those in front of me and I have read them and I don't have any additions or corrections. Does anyone else have any? Nope. Okay, then we should have a motion.
I make a motion to accept the meeting minutes. What was the date again, Shirley?
August 20th.
From August 20th.
Yeah.
I mean, I'll second it. You know, I'm always loath to vote on, I know I can, but I'm always loath to vote on meeting minutes when I wasn't at the meeting.
I know.
Well, we
We
could still,
need you though today.
I know, I'll do it, but I just want everybody to know.
right.
So,
All right, so Bill seconded it. Is there any further discussion? All right, hearing none. All those in favor of approving the minutes of August 20th, 2025 as written, Amy
Aye.
and Bill
aye.
and myself, aye. Those approved unanimously. So now, thank you very much. We can move to the health director's report. And so that's our new health director, John Boulay.
Hello, everybody. Everything's going well. It's been a busy month for me. I've been traveling back and forth for my SE course that I'm currently in on Tuesdays and Thursdays. Let's see, a couple interesting things have happened in the past month. I think actually the day after the meeting, I had to travel to almost New Hampshire to pick up a bat and drive it into DPH to the labs in Jamaica Plain to have it tested because we believe there was an exposure risk for rabies. The good news is the bat came back negative, so that's good. And actually, bookending to the meeting today, this morning I had to issue an emergency permit for a beaver dam in town. The water is flooding pretty high and is actually, I took some pictures this morning. It's actually starting to flood onto the property next door. So I did issue that today. Otherwise, it's been a pretty busy month with multiple soil evaluations, quite a few Title V septic reviews, field inspections for a handful of systems that are getting installed in town currently. This past weekend, there was an event at the fairgrounds, so I had a few food truck inspections to do there. And Julie and I actually this week got our badges set up for the fair coming up in a couple weeks in preparation. But that's about it.
Thank you. Everything's been going very, very smoothly from my perspective. And when you said SE course, I don't know if everybody knows that's soil evaluator course. And this is a big course that John is required to take with the new part of the new shared services initiative. They're trying to bring everyone, all the staff up to speed on their certifications for a lot of things. And this is a very, very big one. So it involves how many weeks, John?
It's multiple weeks of classroom sessions and then an exam, which I'm past all that. And now it's field sessions across the state of Mass. I had one this week. I have another one next week out in Southampton, west of Springfield. And then I'll have a field exam down the road at Bridgewater State.
So that's awesome. That's a lot of work. And it goes, so therefore you won't be in Topsfield even some days during the fair because of this course.
Correct.
So yeah, so we're going to hear more about that in a minute. But that's just one. Perhaps you have more. No, you've been in public health. Maybe you don't have any more courses that you have to take. I don't even know.
I'm sure there will be one or two more.
Yeah.
But
but this is a big one, and it was really hard to get into it, and John Coulon helped him get into it. Didn't you help him? Or no? No, you helped him to get into a food thing, but
Yeah, I
this
was at
one,
the Salem Training Hub.
Sam
Yeah, I
Trent.
know I had to put the application in for this roughly 2 hours after they sent the email. I met a couple people that are in the class now that said this is their fourth try to get in this class because it's only offered twice a year. And people from Rhode Island, Massachusetts, and actually there was even somebody from Vermont in the class. So they
Hmm.
come from all over.
Yeah, you had to be really aggressive to get that. I mean, it's like getting tickets for, the Beatles or something.
Yeah, pretty
Yeah,
much.
insane. And the course costs, I think, $800, and then there's a book for $300, I believe. Luckily, we have,
Yep.
yep, a line item for that, but we're going to seek reimbursement from the Shared Services Grant because those are all reimbursable expenses. So yeah, there's a lot of paperwork to be done. But anyway, so that's it, unless you have anything else, John.
Nope, I'm good.
All right, thank you very much. Any questions for John? Okay, very good. We're going to move on. Hello, Julia. We are so happy to have you here, and you always give us an amazing report. So take it away. Can you unmute yourself? Or do I have to? Ask to unmute.
Hmm.
Ask to unmute. What does that mean?
Should be a little microphone.
Oh, she's not muting now. She's
There you
good.
go. All right, now we can hear you, I think.
Nope.
Nope, can't hear
Can't
you.
hear you.
Ooh, how does this work? Because you're unmuted from my screen.
Yeah, it's got to be her side.
Oh yeah. Uh,
Maybe the microphone on her computer's not working.
uh, uh. Do you have your volume turned up on your computer?
I don't think the volume would affect the microphone.
Okay. Oh, is
Okay, we
that
can
better?
hear you. Yep.
Okay.
Oh,
Sorry,
good.
I hardly ever use this laptop, so it's like foreign to me.
Oh, right.
Okay, so all right. So Julia Lobel, I am the public health nurse. I have the update for the past several weeks since the last meeting. And I just want to say, if Carl is still on this meeting, I think that Carl brings a really unique perspective to this board. So I hope that he does get appointed. I've worked with him several times when I've just volunteered for some of the shifts at the Memory Cafe that they run at the library and at the grounds. And I think Carl will bring a really unique perspective to the Board of Health, especially for pertaining to dementia in the community and what caregivers face also. The Memory Cafe is a great community outreach event, and Healthy People 2030 has identified one of their goals as being improving care for people in the community with dementia and their caregivers. So I think that he can help contribute to that sort of long-term goal as well. So as far as
Thank you
Maven,
for the compliment.
oh, you're welcome. I wish I could make it over there more to the Memory Cafe, but it's been a great way to meet people in the community too and stay connected with them. So I'm always happy to go over there, pop in when I can. The Maven and communicable disease update, it's nothing to report there. It's just been daily coverage, routine coverage of any communicable disease cases that are coming in. Topsfield Fair, as John mentioned, we were over there this week to get our badges and update the list of vendors. I was able to introduce them to Jamie O'Brien and Kurt, the maintenance guy that's there, and gave him just a brief walk around of things that I knew about the fair. But I told him John would give him a much more in-depth tour of the fair and the kitchens and all of the things that he needs to know about. I have begun coordinating the triage area with Chief Collins Brown and the MRC and the local schools. I have approximately half of the shifts covered so far. And we're running 2 shifts for that triage area. So it's 9 a.m. to 3 p.m. and then 3 p.m. to 9 p.m. So if any Board of Health members are interested in volunteering at any of those shifts, just let me know. But it's kind of a fun experience. It's a good way to see the fair kind of from the backside of things. But it's a good collaboration with Chief Collins Brown and the public safety departments there. The immunization clinic plan for Topsfield is in place. Conley's has been scheduled for immunization clinics at the town hall. The next clinic, or the first clinic, is going to be next Wednesday, September 24th. It's from 1 to 3, and the COA is running an ice cream social along with that, just as they did that last year, and that had very positive experiences with that. And then the next clinic will be October 22nd, 2 to 4 p.m. And then the third clinic will be Monday, November 17th, 3 to 6 p.m. We're currently reviewing the budget for ordering the private vaccines that I can use for homebound folks in the community, and then also for walk-ins. So we just need to review that budget and get that approved by John and Cheryl. And then I'll order a small quantity of vaccines to have in the health department. I've also continued to provide the 9 monthly wellness clinics for seniors. I've talked about these before. These are 2-hour clinics around the community in various senior living communities. So in my notes, I will put down the breakdown of all these clinics. I have the breakdown for January to June. I mentioned this at the last meeting. I didn't have the numbers right there, but I did want to just highlight the clinics that have run from January to June. There was 45 standing or scheduled clinics. Some of those clinics ended up getting canceled due to either holidays that fell on a Monday or Tuesday. There was, I think, 2 days that I was sick that I couldn't make a clinic, and then also the site had canceled some of the clinics. So altogether, there was 37 clinics held January to June, which totaled 167 people seen through those community-based wellness clinics. And the average that I worked out is about 4.5 people that are seen during those clinics. So I also just put some highlights in. I've talked about these clinics before, though. They used to be called blood pressure clinics in the community. When I took them over, I expanded them to call them wellness clinics because a lot of folks come in for things other than blood pressure. Certainly, that is one of the main draws for people coming in, but I'm also connecting people in the community with different services that are available, educating them about simple things like the file of life that they should have posted on their fridge. I work with the fire departments and get each of the town's file of life so that I can give those out at the clinics. I answer different questions about medications, common illnesses or chronic conditions. I provide education about different services that are available. So whether it's through like the aging services or if they need any type of home health aides coming in, I provide different education on that. And then also the other connections to town services. So whether it's Meals on Wheels, the Council on Aging, the library, the veterans agent, or the food pantry. I have some folks that are in need of using the food pantry, but they don't have any background information about it, or they have misinformation about a food pantry. So I'm able to give them that information. And even the library has a book delivery program for seniors that a lot of the seniors that are homebound don't know about. So there's just all different things that come up. It's hard to talk about all the different things that come up, but there's a lot of different things, and there's been a lot of positive feedback from those clinics. So I'll include just some of the highlights also in my notes from those clinics. We've continued with the Tri-Town Senior Visiting Program. So those are the home visits that I do that come from referrals from either the Council on Aging, the fire department, family members. Sometimes it's neighbors. Sometimes people themselves will call and ask for a home visit. And then the most common reasons for these visits are related to either recent falls. It may be related to dementia, some type of dementia, and just connecting these people with services in the community. There has been a lot of changes just over the summer with the folks that I've been seeing. Unfortunately, I had one person that I was seeing that passed away, one person that moved into long-term care, one person that moved into memory care. So there's always different changes with programs like that. And then just some of the additional programs and services I'm still waiting on, there was drafts of for some policies and procedures that I submitted specifically for these senior visiting programs and the wellness clinics that I wanted reviewed, just so that there was some sort of procedures put in place for these clinics. I'm still waiting on that. They do need to get updated a little bit because American Heart Association just released some new guidelines for high blood pressure. So specifically, that would apply to the wellness clinics and home visits. They differentiated between severe hypertension and hypertensive crisis and what to do in those situations. So that's really important for us to follow those guidelines and know when to call 911 and know when somebody needs to go to their primary care provider, things like that. So that is still on the list to get done. I have provided CPR training last month in Boxford and Topsfield for the town employees. So that was offered, I think it was the last couple weeks of August, and we had just a small turnout for that. But the hope is to continue doing programs like that for town employees and for the community. The North Shore Mothers Visiting Program, I have not had any takers contacting me for home visits on that program at this point, but we do continue to send out the postcards inviting new mothers to a one-time visit that helps address maternal health. The next opioid task force meeting is actually tomorrow morning at 10 a.m. at Town Hall. If anybody's interested in going to that, there hasn't been a meeting in several months now, so I don't have any type of official update on that. And that is it from me for now. Oh, you're muted, Cheryl.
Thank you. Anybody have any questions or comments for Julia? Okay, thank you. Oh, Amy, did you say something? Now you're muted, except it doesn't say you're muted. It still can't hear you. That's so weird.
Just shows you how vital Sue is.
Well, so,
Yeah.
oh, I can hear Amy. I don't know what happened. All right.
Say thank you. That was great, Julia.
Thank
You
you.
got very, very soft. I'm just saying. Okay. All right. So now we're on to new business. And the first item, and I separated these on purpose, it's the resignation of Tri-Town Public Health Nurse Julia Lobel from the Shared Services Agreement group, and then also a new position for Julia in Topsfield. So Julia, so I'm going to let Julia say whatever you feel you need to say, or nothing.
Well, I don't have much to say. I did resign from my position as the Tri-Town Public Health Nurse effective September 5th, 2025. There was changes being implemented to the grant, and I just felt I was not the person moving forward to work within that grant. So Topsfield has, in the meantime, hired me as the interim public health nurse for September and October. And so I will continue working on the projects that I stated, with the exception of the maternal visiting program that will be paused just because of bandwidth time. So
it's sort of limited good news, because you're now totally hours, but only for a month and a half until October 31st. And then
yes.
I just spoke with Kevin about it this morning, and I said, are there any plans, beyond that? And he said, not right now. So it's the fair coming up and all this stuff. But I also asked him, well, is this on the agenda? Hold on. Oh yeah, public health. Well, excellence update. I mean, that's under old business. I asked if there was a meeting coming up of the advisory board, and yes, the meeting is scheduled for October 30th of the advisory board for that shared services. And who's on that advisory board is Kevin and Matt, who is the Board of Health chairman in Middleton, and Kendall, who is the health director in Boxford. So this is FY 26 for this grant. We don't have any, we haven't received any budget information, any scope of work, any deliverables, or basically anything, any information. We, from time to time, we ask to have Connor, the Tri-Town inspector, come over and help us, and he helps us occasionally. I believe they hired a Tri-Town social worker for either 4 or 5 hours per week for the 3 towns. The advisory board was not involved in interviews or anything for that position, which normally we would be. It's not a lot of communication. So I'm sorry I have such a grim report. I wish it were better, but I don't know what else to say. And I guess that would be that's the public health excellence update. John Boulay, do you have anything that I should have said that you can think of?
No, I don't have any other updates from any of that either. So I know
Okay.
Kevin had mentioned, what did he say, October 30th? There was a potential meeting, but I don't think it's set in stone yet.
Yeah, we certainly haven't seen an agenda, or well, I wouldn't see it anyway, but there you have it. But those are public meetings. When it is set, it will be posted. It has to be posted in every town. They are public meetings, and so anyone can go, anyone, and ask questions, because this is public money. This is your state, federal tax money at work. So it should be working for us. That work for the entire population. Just saying. All right. Julia, thank you very much for that comprehensive report, as usual. We were thrilled that you were here for however long. Julia's also doing a little part-time work for the as a school nurse in Topsfield, so that's pretty wonderful. So pretty soon you'll know absolutely every aspect of public health nursing in Topsfield, and that's great. We're going to endeavor to keep you however we can for as long as we can. This guy I can pledge to you. I will do my best. So
Thank you for your support, Cheryl. And I'm sorry to go, but I did see a lot of potential for this position long term, for even once this grant funding went away. But things change. So
right. Well, you are fantastic. So thank you, Julia. Okay. Thanks for coming. So the next item on the agenda is Topsfield Fair preparation, and also in conjunction with that is an agreement with John Coulon for the Topsfield Fair. Did we send that to the board members? Did you get it? You got it. Okay. So I'm going to turn it over to John Boulay and John Coulon to talk about this. And then we'll talk about the proposal. So John B., it's handing it over to you.
So yeah, we're looking to bring on John Coulon to help us do a lot of the inspections and work for the fair, the training prior to the fair, and any reporting or anything else needed during the fair, for roughly 13 or 14 days, depending on how you look at it.
That's it in a nutshell. What we're looking for this year is to really delineate the proposal that John has submitted about what his scope of work would be at the fair, so it was presented today to Kevin. His goals are, as it says, utilize his 20 years of experience as Board of Health inspector to guide and work with the new health director to provide a transfer of his professional knowledge and experience to assure thorough public health oversight and promote efficient coordination among health and safety team members. And that's a big goal, because it is big. Assure that fair workers have the knowledge and equipment needed to deliver safe food to the public and provide daily on-site public health presence at the fair in order to prevent foodborne illness, assure safe housing for workers, assure sanitary waste management, assure clean drinking water, and control disease vectors. Scope of work includes 4 basic categories. One is coordinating and performing inspections. The second category is training. The third category is record keeping. And the fourth is reporting. And under the inspections, I just want to delineate that because it involves food inspections for all the food vendors at the fair, which have averaged 125 temporary food permits during the fair. Black water storage and disposal, gray water storage and disposal, solid waste storage and disposal, potable water connections, vector control, vermin control, animals, temporary housing inspections, and monitoring for. We tried to get the number of workers who live on site at the fair for the duration of the fair, and I don't think we got an answer. John, do you happen to know that number off the top of your head, John Coulon?
No, it varies each year, and the Fiesta shows brings in dormitory trailers to meet whatever need they have for the fair workers that are requesting on-site dormitory cubicles, if you will. So we inspect with the team of fire inspectors and a building inspector.
Yeah, and then some of them live in trailers. Do you get involved in trailers that they might have at all? Or just
No,
okay.
some fair workers live in recreation vehicles, RVs, but some will live in tents on the ground and in the back of a pickup truck bed. Some bring their dogs. So part of my rounds is trying to make sure that dog droppings are picked up. So it's pretty wide ranging. So when I say doing the rounds, I mean walking the perimeter of the tree line as far as you can see on the fairgrounds, and then walking the interior, which is mostly checking on food vendors.
Yeah, and the housing is important because years ago, that the area back where some of the tents would be located, which was near the parking near the river, flooded. The tents got flooded. Some septic water got mixed in with the flood waters. And then another year, some people staying in a tent used a space heater, and actually 2 people in that tent died. So, yeah, and so we are concerned about the health and safety of the workers. And they're temporary living here in our town, and that's our concern. So, and as part of the effort, training, John provides a PowerPoint presentation to all the food vendors for 2 days, October 1st and 2nd. So those are the days prior to the start of the fair. And I think any of us, if you're curious, I've been to listen to it. I think we could go and listen if we wanted to. It's
Absolutely.
very informative. And that requires, and both Johns will be on site for those 2 days, I think, because the inspections start, trying to get people inspected and ready to open. And I believe you start on those 2 days. Is that true?
We
Is that
start on Tuesday, 3 days before the fair opens.
3 days?
But 3 days before, however, most of the inspections are conducted Thursday and Friday. It's very intensive, and it requires that you know what you're looking for. You either sign the permit or you do not. You explain why you are not, and you move on. And I explained to anybody assisting, any inspectors assisting, that if anybody gives them a hard time, they just text me and move on, and then I go and deal with whomever is trying to share their bad day with others. So
Such a
it gets done.
It gets done, and I've been on John's rounds with him, and inevitably, there will be people who are not quite ready. They don't have a thermometer, or they don't have the proper cooling or heating or sanitary. They didn't bring gloves. They don't have a way to wash their hands. You name it. And so that involves like, well, you're not ready, so I'll be back in 3 hours, and then I'll expect you to have
Or,
those things,
or
or
whenever I'll be
whenever
back.
they be back.
I'll be back.
So
But
there's a lot of moving back and forth. There's a lot
that's
of
right.
communication that has to take place over your team of inspectors, which you will usually you've been bringing in other people to inspect. And can you tell us anything at all about those people now, or not? It's okay.
I have not yet built the team for certain because my doing the fair has not been certain. It needs to have not only you folks, but then the town administrator needs to approve it. And I'll hit the ground running if the approvals come, and it'll mean communication with our colleagues in other towns. And I sell it by saying, "Do you work a mass gathering normally?" Well, this is the opportunity for either you or the people who work for you to get some real-time training. And they come to the orientation sessions, and they come to the inspection days, and we especially need them Thursday and Friday, October 2nd and 3rd. But also during the fair, I bring them in to bring them on the rounds to show them what a holistic mass gathering from the public health perspective looks like. Because some folks believe that a spot check every few days is sufficient, and it is sufficient only as much as a spot check is going to be useful or successful. You can apply spot checking to any discipline, and then you can apply my approach, which is a total immersion management by walking around, talking to people, having a conversation, and and moving on. And I've been able to get a lot done over the 13 years that I was employed by the town. First couple of years, people would look the other way, run the other way when they saw me coming, and then I saw the shift where people would be uh, asking me to come over, and they'll say, "Hey, we have a question. Hey, we were talking about this and that yesterday or this morning, and what should we be doing? What do you think about it, etc." And that's the way it really should be. But it takes a lot of work, and it takes a lot of being there. So thankfully, I really enjoy the fair, and I will be there just because I'm a lifetime member of the Essex Agricultural Society, and we get passes for every day of the fair. Anyway, it's something I'm looking forward to, but we need that approval from you folks as well as the town administrator.
Yes, and that was what I was working on that all afternoon. And so to continue on just to reviewing the proposal here, it involves record keeping. I think there was an attachment that was sent to you about all the things that uh, go into the inspection, and then those records have to be submitted to Topsfield for our records. And then reports would need to be written to various people. And so John is asking it to be just an overall contract, and the charge is $7,500, which is, if you said, so it's like the fair itself is open for 11 days, and then you add 3 or 4 more days onto that. You know, you're up to about 15 days. And so I brought this to Kevin earlier today and tried to explain all of it. And even though it does say, I might add, in the goals, provide daily on-site public health presence, Kevin has asked that we add a bullet to the training part and say, be physically present every day at the fair, each day that it is in operation, and as needed / on call in order to satisfy the terms of this agreement. So I can, these are the words that Kevin and I settled on. Bill
When has
is,
that not happened? I mean, you know,
I know.
sorry, but I
So,
get irritated.
but so this year he wants to write up, for a formal contract, and he said that that's necessary because we, even though the money is within our budget, we would have to collect money from some other line items. It's more than a 20% increase over what was spent on the fair in previous years, and that requires a contract. This is the way it was explained to me this afternoon. And so he's planning. I mean, I don't write contracts. I'm saying, Kevin, I mean, here's the words. I don't have the contract format. Somebody will write it. And um uh, gee, things keep popping up.
I don't have an objection to contracts per se. Of course, I couldn't.
Um,
But that, never mind.
I know.
Cheryl, do you need us to vote on this?
John,
Yes.
I'd recommend that you would want one, by the way, if I were your lawyer.
Want what? A contract?
Contract, yeah.
Yeah. I mean, it should be. So yes, we need a vote. We're looking for a vote
A vote for what, Cheryl?
for what that was submitted. The proposal.
That we want to retain John in accordance with his proposal,
Exactly.
and then as a result of that, someone will write a contract.
Yeah.
Okay, so we could have a motion to retain John Coulon for the fair in accordance with his proposal, which will be attached to this motion, and then Sue can attach it to the minutes or whatever she wants to do.
Yep. Okay.
Is that right with you, John?
Yes.
I second that.
Thank you. Is there any further discussion? Okay, hearing none.
Wait, what about other John? Are you okay with that, John?
Uh,
John
or
Bouley, are you okay
John-
with that?
John
Yep,
Boulay?
I'm good.
Okay, all right, good.
Okay. It looks like no further discussion. All those in favor of Bill's motion, say aye. Bill,
Aye.
Amy,
Aye.
myself, aye. The motion passes unanimously. Thank you. That this proposal will be in the minutes as written with the one thing that I added. And I do have the attachment for all the food inspections. Yeah, that was sent out. Okay. All right. I think that's it. Concludes that item. Those were big items. And I think yeah, and I think we're up to bills paid. Does everyone agree with that?
Yes.
Okay. Agenda bills paid. We paid for dead animal pickup. I think there were 2 deer and another big animal of some sort. Office supplies. And
I just out of curiosity, how does the dead animal pickup work?
oh boy. Yeah. So
Because a deer just up and died on my property a couple of years ago, and the town wouldn't pick it up.
right. If it dies on public property, they don't pick it up. It's
It dies on
yours.
private property, you mean?
Oh, I'm sorry. Yeah, I meant to say
Yeah.
private. Yeah, it's your deer.
Yeah.
I know. Yeah, years ago, the DPW kind of did it and then they stopped. And so Wendy had to scramble to find a person to pick them up. And it was hard because nobody wants to do this. And this one person said he would not only pick them up, but he would dispose of them on his property because the other problem that happened a few years ago, they used to be buried on some town land, and that piece of land was full and could accept no more dead animals. So then they had to find somebody who had a pet cemetery of some sort to bury them. And all these requirements are not, they're not easy. So we have this guy doing it. And yeah. Um, and then the other things we paid
Excuse me.
for some John Boulez mileage around the state, as he talked about, and soil evaluator book and class, but those were going to seek reimbursement, but they'll be paid first from the budget and then reimbursed to the town. Any questions on the bills? And then the next thing is the revenue. So we took in a total of 1,000, or the town took in $1,275. Of that, 1,075 were for septic related inspections and permits mostly, and $200 was for temporary food permits. Those monies go directly into the town budget, or what would you call it, town account. They don't come back to the Board of Health in specifically to us, but presumably they offset our expenses for salary and items. But I think that I don't have any correspondence. And I believe that's all the items that I have. Does anybody else have any items or any questions on anything? No. Okay. All right, we're looking then at a motion to adjourn, and it is 7:54 p.m.
I move to adjourn.
Okay,
I'll second that.
thank you. Any discussion? All those in favor of adjourning, Bill?
Right.
Amy?
Aye.
And I thank you. Thank you for a wonderful meeting.